Hello, nursing students. Welcome to Nursing Exam Preparation, your ultimate resource for excelling in nursing exams with confidence. In today's video, we'll guide you through 150 multiple-choice questions, MCQs, on maternal care, each carefully designed to challenge your understanding and deepen your knowledge of this crucial topic. Detailed explanations accompany every question, helping you not only select the correct answer, but also understand the reasoning behind it. Whether you're starting your studies or revising for an upcoming exam, this video is filled with valuable content to test your skills, enhance your critical thinking, and reinforce core maternal care concepts. Don't forget to like this video, share it with your fellow students, and subscribe to Nursing Exam Preparation for more essential resources. Be sure to hit the bell icon to stay updated on our latest videos, all crafted to help you succeed. After you've completed the video, share your score in the comments below. We'd love to hear how you did. Let's dive in and work together to master maternal care and achieve exam success. 1. A 32-year-old pregnant woman at 28 weeks gestation comes in for a routine prenatal visit. Her blood pressure is 142/92 mmHg. Which of the following is the most likely next step? A. Administer antihypertensive medication immediately. B. Recheck blood pressure in 15 minutes and assess for symptoms of preeclampsia. C. Start induction of labor. D. Schedule a cesarean delivery. Answer. B. Recheck blood pressure in 15 minutes and assess for symptoms of preeclampsia. Rationale. Elevated blood pressure is concerning, but it is not diagnostic of preeclampsia without proteinuria and other symptoms. Rechecking the blood pressure allows confirmation of hypertension and assessment for other signs like headache, visual disturbances, and edema. The other options are premature. Antihypertensive medications are typically prescribed after confirmation of severe hypertension. Induction and cesarean are not indicated at 28 weeks, and preeclampsia diagnosis requires more than just high BP***. 2. Which of the following is the most common complication of pregnancy in the United States? A. Preeclampsia. B. Gestational diabetes. C. Miscarriage. D. Hyperemesis gravidarum. Answer. C. Miscarriage. Rationale. Miscarriage is the most common complication of pregnancy, affecting up to 20% of pregnancies. Preeclampsia and gestational diabetes are common, but they do not occur in as many pregnancies as miscarriage. Hyperemesis gravidarum is a severe complication but is less common overall. 3. A pregnant woman presents at 39 weeks gestation with irregular contractions and is not in active labor. What is the best course of action for this patient? A. Start an oxytocin infusion to induce labor. B. Encourage ambulation and monitor for progression of labor. C. Perform a cesarean delivery. D. Administer pain relief and prepare for an epidural. Answer. B. Encourage ambulation and monitor for progression of labor. Rationale. Irregular contractions without progression of labor are common before true labor begins. Encouraging ambulation and monitoring the patient allows for natural progression. Induction of labor, cesarean delivery, and immediate pain relief may be indicated later, but are not appropriate at this stage without signs of active labor. 4. A 4-day postpartum patient presents with signs of fever, uterine tenderness, and foul-smelling lochia. What is the most likely diagnosis? A. Endometritis. B. Mastitis. C. Pulmonary embolism. D. Postpartum depression. Answer. A. Endometritis. Rationale. Endometritis is a common postpartum infection that typically presents with fever, uterine tenderness, and foul-smelling lochia, often after a cesarean delivery. Mastitis would present with breast pain and fever, not uterine tenderness. Pulmonary embolism typically presents with dyspnea and chest pain. Postpartum depression manifests with mood disturbances, not physical symptoms of infection. 5. Which of the following is a major risk factor for the development of gestational diabetes? A. Underweight prepregnancy. B. Age over 25 years old. C. High levels of physical activity. D. Family history of diabetes. Answer. D. Family history of diabetes. Rationale: a family history of diabetes is a major risk factor for gestational diabetes. Being over 25 years old, while a moderate risk factor, is less significant than having a family history of diabetes. Physical activity and being underweight are protective factors for gestational diabetes. ***. 6. A 28-year-old pregnant woman at 22 weeks gestation comes in for her routine prenatal checkup. Her hemoglobin is 10G/DL. What is the most likely diagnosis? A. Iron deficiency anemia. B. Gestational hypertension. C. Normal pregnancy. D. Thrombophilia. Answer: A. Iron deficiency anemia. Rationale: anemia is common during pregnancy, and iron deficiency anemia is the most common type. A hemoglobin level of 10G/DL is below the normal range for pregnancy, and iron supplementation is typically prescribed. Gestational hypertension would not cause anemia, and thrombophilia is a condition related to clotting, not anemia. ***. 7. A nurse is educating a pregnant woman at 28 weeks about common symptoms of preeclampsia. Which of the following should the nurse include as a potential warning sign? A. Severe headache. B. Increased appetite. C. Frequent urination. D. Abdominal bloating. Answer: A. Severe headache. Rationale: severe headache is a classic warning sign of preeclampsia, often associated with elevated blood pressure. The other options are not typical signs of preeclampsia. Increased appetite and frequent urination are not indicative of preeclampsia. Abdominal bloating can occur, but it is less specific and not a hallmark symptom. ***. 8. A 35-year-old woman at 34 weeks gestation reports visual disturbances, including blurred vision and seeing spots. Which of the following is the most likely cause of these symptoms? A. Preeclampsia. B. Normal pregnancy symptoms. C. Gestational diabetes. D. Retinal detachment. Answer: A. Preeclampsia. Rationale: visual disturbances, such as blurred vision and seeing spots, are common symptoms of preeclampsia due to increased blood pressure and vasospasm. While some visual changes can occur in normal pregnancy, the severity of the symptoms described here points to preeclampsia. Gestational diabetes typically does not cause visual disturbances, and retinal detachment is a rare complication that would present differently. ***. 9. A pregnant woman in labor is requesting pain relief. Which of the following is a non-pharmacologic pain management option for labor? A. Epidural anesthesia. B. Breathing exercises. C. Fentanyl injection. D. Nitrous oxide. Answer: B. Breathing exercises. Rationale: breathing exercises are a common non-pharmacologic approach to pain management during labor, promoting relaxation and focus. Epidurals and fentanyl injections are pharmacologic interventions. Nitrous oxide may be used, but it is considered a mild analgesic, not a purely non-pharmacologic method. ***. 10. A postpartum woman expresses feelings of sadness and hopelessness, having difficulty bonding with her newborn. She states, "I feel overwhelmed and unsure of my ability to care for my baby." What is the most likely diagnosis? A. Postpartum depression. B. Postpartum psychosis. C. Baby blues. D. Normal postpartum adjustment. Answer: A. Postpartum depression. Rationale: postpartum depression is characterized by persistent feelings of sadness, hopelessness, and difficulty bonding with the baby. The symptoms described are more severe and long-lasting than the baby blues, which typically resolve within 2 weeks. Postpartum psychosis is more severe and includes delusions and hallucinations, which are not present in this case. Normal postpartum adjustment does not usually cause such intense emotional distress. ***. 11. A 30-year-old woman at 36 weeks gestation is diagnosed with a urinary tract infection, UTI. Which of the following medications is considered safe to treat a UTI during pregnancy? A. Ciprofloxacin. B. Amoxicillin. C. Doxycycline. D. Tetracycline. Answer: B. Amoxicillin. Rationale: amoxicillin is a safe choice for treating UTIs during pregnancy, as it is classified as a Category B drug. Ciprofloxacin and doxycycline are contraindicated due to potential risks to the fetus. Tetracycline should also be avoided as it can cause tooth discoloration in the fetus. ***. 12. A pregnant woman is found to have a low platelet count during her second trimester. Which of the following conditions is most likely to cause thrombocytopenia in pregnancy? A. Idiopathic thrombocytopenic purpura, IDP. B. Gestational hypertension. C. Preeclampsia. D. Gestational thrombocytopenia. Answer: D. Gestational thrombocytopenia. Rationale: gestational thrombocytopenia is common in pregnancy and typically resolves postpartum. IDP can cause thrombocytopenia, but is rare. Preeclampsia and gestational hypertension can sometimes cause thrombocytopenia, but are less common causes in the second trimester. ***. 13. Which of the following is a sign of fetal distress during labor? A. Fetal heart rate of 120 to 160 bpm. B. Variable decelerations of fetal heart rate. C. Spontaneous rupture of membranes. D. Presence of meconium in amniotic fluid. Answer: B. Variable decelerations of fetal heart rate. Rationale: variable decelerations, often caused by umbilical cord compression, are a sign of fetal distress. A normal fetal heart rate is between 120 to 160 bpm. The presence of meconium may be a sign of fetal distress, but is not specific for it. Spontaneous rupture of membranes is a normal event in labor. ***. 14. A 38-week pregnant woman with a history of preeclampsia is at risk for developing which of the following during labor? A. Hemorrhoids. B. Uterine rupture. C. Postpartum hemorrhage. D. Placenta previa. Answer: C. Postpartum hemorrhage. Rationale: preeclampsia increases the risk of postpartum hemorrhage due to potential uterine atony and coagulopathy. Hemorrhoids and uterine rupture are not directly related to preeclampsia. Placenta previa is not related to preeclampsia. ***. 15. A pregnant woman at 28 weeks gestation is diagnosed with gestational diabetes. Which of the following interventions is most appropriate to manage this condition? A. Restrict carbohydrate intake and monitor blood glucose levels. B. Start insulin therapy immediately. C. Encourage the patient to avoid all sugar-containing foods. D. Recommend a low-protein diet. Answer: A. Restrict carbohydrate intake and monitor blood glucose levels. Rationale: gestational diabetes is managed with diet modification, including restricting carbohydrates and monitoring blood glucose levels. Insulin therapy is initiated if blood glucose cannot be controlled by diet alone. Avoiding all sugar is not recommended, and a low-protein diet is not a standard approach for managing gestational diabetes. ***. 16. A pregnant woman who is 34 weeks gestation presents with swelling in her feet, legs, and face. Her blood pressure is 140/90 mmHg. What is the most likely diagnosis? A. Gestational hypertension. B. Preeclampsia. C. Deep vein thrombosis. D. Normal pregnancy. Answer: B. Preeclampsia. Rationale: preeclampsia is characterized by hypertension and edema, often accompanied by proteinuria. Gestational hypertension can also cause high blood pressure, but typically does not present with edema. Deep vein thrombosis may cause leg swelling but would not typically cause facial swelling or hypertension. Swelling is common in normal pregnancy, but the elevated blood pressure suggests a possible complication. ***. 17. A postpartum woman is experiencing excessive bleeding and her uterus is boggy and displaced to the right. What is the most likely cause of her symptoms? A. Uterine atony. B. Placenta accreta. C. Retained placenta. D. Postpartum depression. Answer: A. Uterine atony. Rationale: uterine atony, or the failure of the uterus to contract effectively after delivery, is the most common cause of postpartum hemorrhage. A boggy uterus is characteristic of this condition. Placenta accreta and retained placenta are causes of hemorrhage, but would typically present with other signs. Postpartum depression does not cause physical symptoms like uterine atony. ***. 18. Which of the following is the first-line treatment for opioid withdrawal in a pregnant woman? A. Methadone. B. Buprenorphine.
C. Naloxone.
D. Benzodiazepines. Answer: A. Methadone. Rationale: methadone is the first-line treatment for opioid withdrawal in pregnant women due to its ability to prevent withdrawal symptoms and minimize fetal risk. Buprenorphine is an alternative, but methadone is more commonly used. Naloxone can precipitate withdrawal symptoms and is not recommended in pregnancy. Benzodiazepines are not used for opioid withdrawal due to potential harm to the fetus. ***. 19. A pregnant woman is experiencing a headache, blurry vision, and swelling in her hands and feet. Which of the following lab findings is most consistent with preeclampsia? A. Low platelet count. B. Elevated liver enzymes. C. Proteinuria. D. Elevated blood glucose. Answer: C. Proteinuria. Rationale: proteinuria is a key diagnostic criterion for preeclampsia, along with hypertension and symptoms like headaches and swelling. Low platelet count, elevated liver enzymes, and elevated blood glucose can be seen in various conditions, but proteinuria is most consistent with preeclampsia. ***. 20. A nurse is educating a pregnant woman at 32 weeks gestation on signs of preterm labor. Which of the following symptoms should the nurse emphasize as a warning sign? A. Decreased fetal movement. B. Persistent low back pain or cramping. C. Increase in appetite. D. Increased fetal heart rate. Answer: B. Persistent low back pain or cramping. Rationale: persistent low back pain or cramping is a warning sign of preterm labor, along with regular contractions. Decreased fetal movement is also concerning, but not specific for preterm labor. An increase in appetite and fetal heart rate are not typically related to preterm labor. ***. 21. Which of the following is the primary goal in the management of hyperemesis gravidarum? A. Prevent dehydration and electrolyte imbalances. B. Control blood glucose levels. C. Promote weight gain. D. Encourage frequent meals high in fat. Answer: A. To prevent dehydration and electrolyte imbalances. Rationale: the primary concern in hyperemesis gravidarum is preventing dehydration and correcting electrolyte imbalances. Managing blood glucose and promoting weight gain are secondary considerations. High-fat meals are not recommended because they may exacerbate symptoms. ***. 22. A 40-week pregnant woman is experiencing a prolonged second stage of labor. Which of the following is the most likely cause? A. Cephalopelvic disproportion. B. Maternal obesity. C. Maternal exhaustion. D. Fetal macrosomia. Answer: A. Cephalopelvic disproportion. Rationale: cephalopelvic disproportion occurs when the fetus's head is too large to pass through the mother's pelvis, leading to prolonged labor. Maternal obesity, exhaustion, and fetal macrosomia can contribute to labor difficulties, but are not as commonly the direct cause of a prolonged second stage. ***. 23. Which of the following actions should be prioritized when caring for a postpartum patient with a suspected deep vein thrombosis, DVT? A. Administering intravenous heparin. B. Applying heat to the affected leg. C. Encouraging early ambulation. D. Elevating the affected leg and applying compression stockings. Answer: A. Administering intravenous heparin. Rationale: intravenous heparin is the primary treatment for DVT to prevent clot extension and embolism. Early ambulation is not appropriate until the clot is managed, and heat is not recommended. Elevating the leg and applying compression stockings may help with symptoms, but are not the primary interventions for DVT management. ***. 24. A nurse is educating a pregnant woman on the signs of labor. Which of the following should the nurse include as a sign of impending labor? A. Increased vaginal discharge. B. Sudden increase in fetal movement. C. Decreased appetite. D. Complete cessation of contractions. Answer: A. Increased vaginal discharge. Rationale: increased vaginal discharge, known as the bloody show, is a common sign of impending labor. Sudden changes in fetal movement are concerning and should be assessed. Decreased appetite and cessation of contractions are not signs of impending labor. ***. 25. A postpartum woman is breastfeeding and reports feeling fatigued, with cold hands and feet. Which of the following is the most likely cause of her symptoms? A. Hypothyroidism. B. Postpartum hemorrhage. C. Postpartum depression. D. Mastitis. Answer: A. Hypothyroidism. Rationale: hypothyroidism is a common condition postpartum that can cause fatigue, cold extremities, and other symptoms. Postpartum hemorrhage would typically present with signs of excessive bleeding. Postpartum depression affects mood, not physical symptoms like cold hands and feet. Mastitis presents with breast pain and fever. ***. 26. A 35-week pregnant woman presents with high blood pressure and proteinuria. What is the most likely diagnosis? A. Chronic hypertension. B. Preeclampsia. C. Gestational hypertension. D. Eclampsia. Answer: B. Preeclampsia. Rationale: preeclampsia is diagnosed by the combination of high blood pressure and proteinuria. Chronic hypertension would have been diagnosed earlier in pregnancy, and gestational hypertension does not typically present with proteinuria. Eclampsia is severe preeclampsia with seizures, which is not indicated in this case. ***. 27. Which of the following is a contraindication for the use of nitrous oxide during labor? A. Recent history of substance abuse. B. Active infection. C. Hyperemesis gravidarum. D. Pre-existing hypertension. Answer: A. Recent history of substance abuse. Rationale: nitrous oxide is contraindicated in patients with a recent history of substance abuse due to the risk of addiction and misuse. It can be used in labor for pain relief for most patients, even those with infection, hyperemesis gravidarum, or hypertension, provided other conditions are stable. ***. 28. A woman at 24 weeks gestation presents with dark red vaginal bleeding. Her uterus is firm, and fetal heart tones are present. What is the most likely diagnosis? A. Placental abruption. B. Placenta previa. C. Ectopic pregnancy. D. Cervical insufficiency. Answer: A. Placental abruption. Rationale: placental abruption is characterized by dark red vaginal bleeding, a firm uterus, and fetal heart tones. Placenta previa usually presents with bright red bleeding and a soft uterus. Ectopic pregnancy typically occurs in early pregnancy, and cervical insufficiency leads to painless cervical dilation without bleeding. ***. 29. A postpartum woman is experiencing a headache, nausea, and vomiting. Her blood pressure is 180/110 mmHg. What is the most appropriate intervention? A. Administer antihypertensive medication and assess for preeclampsia. B. Encourage increased fluid intake. C. Administer antiemetics. D. Perform a CT scan to rule out brain injury. Answer: A. Administer antihypertensive medication and assess for preeclampsia. Rationale: this patient presents with signs of postpartum preeclampsia, which can occur after delivery. Administering antihypertensive medication is necessary to lower her blood pressure. Increased fluid intake and antiemetics may provide symptom relief, but do not address the underlying condition. A CT scan is not needed unless there are signs of a neurological emergency. ***. 30. A nurse is assessing a postpartum woman and notices that her uterus is firm and at the level of the umbilicus. Which of the following is the next appropriate step? A. Massage the uterus to ensure it is contracted. B. Apply a warm compress to the abdomen. C. Administer oxytocin as ordered. D. Encourage the patient to void. Answer: D. Encourage the patient to void. Rationale: a firm uterus at the level of the umbilicus suggests that the uterus is contracting properly, but the bladder may be full and displacing the uterus. Encouraging the patient to void can help reposition the uterus and prevent further complications. Massaging the uterus is necessary if it is boggy, and oxytocin may be administered if there is excessive bleeding. A warm compress is not appropriate in this scenario. ***. 31. A 30-week pregnant woman presents with complaint of heartburn and indigestion. What is the most appropriate recommendation to manage these symptoms? A. Recommend the use of antacids. B. Suggest sleeping in a supine position. C. Encourage high-fat meals to ease digestion. D. Suggest avoidance of small, frequent meals. Answer. A. Recommend the use of antacids. Rationale. Heartburn and indigestion are common during pregnancy. Antacids can help alleviate symptoms, but caution should be exercised with certain types, like those containing sodium. Sleeping in a supine position is not recommended due to the risk of supine hypotension syndrome. High-fat meals can worsen heartburn. Small, frequent meals are typically encouraged, not avoided. **. 32. A nurse is caring for a postpartum woman who is experiencing a severe headache, visual disturbances, and swelling of the face. What is the most likely diagnosis? A. Preeclampsia. B. Postpartum depression. C. Normal postpartum adjustment. D. Intracranial hemorrhage. Answer. A. Preeclampsia. Rationale. Preeclampsia can continue or develop postpartum, presenting with symptoms such as headache, visual disturbances, and facial swelling. Postpartum depression affects mood, not physical symptoms like swelling or visual disturbances. Normal postpartum adjustment would not present with such symptoms. Intracranial hemorrhage could cause headache, but it would typically present more acutely. **. 33. A woman in labor is experiencing prolonged rupture of membranes. What is the primary concern related to this situation? A. Increased risk of infection. B. Premature labor. C. Preterm labor. D. Uterine rupture. Answer. A. Increased risk of infection. Rationale. Prolonged rupture of membranes increases the risk of infection, including chorioamnionitis. Preterm labor and premature labor are possible, but the primary concern with prolonged rupture is infection. Uterine rupture is less common but still a concern with any labor. **. 34. A nurse is educating a 20-week pregnant woman about normal fetal movement patterns. Which of the following should the nurse advise the patient? A. Fetal movements should be felt regularly starting at 12 weeks. B. Decreased fetal movement is an emergency and should be reported immediately. C. Fetal movement is usually noticeable by 36 weeks. D. Normal fetal movement should be reported only if it decreases significantly. Answer. B. Decreased fetal movement is an emergency and should be reported immediately. Rationale. Decreased fetal movement can indicate fetal distress or other complications, and the patient should be advised to report it immediately. Fetal movements are usually felt around 18 to 20 weeks, not 12 weeks. Normal fetal movement may change in frequency, but any significant decrease should be assessed. **. 35. A postpartum woman reports difficulty voiding and pain in her lower abdomen. What is the most appropriate action for the nurse to take? A. Catheterize the patient to relieve the bladder. B. Perform a pelvic exam to assess for trauma. C. Encourage the patient to ambulate and increase fluid intake. D. Administer analgesics to relieve the pain. Answer. C. Encourage the patient to ambulate and increase fluid intake. Rationale. Difficulty voiding after childbirth is common due to swelling or trauma. Encouraging ambulation and fluid intake can help resolve this. Catheterization may be necessary if the patient is unable to void after other measures, but it should not be the first step. A pelvic exam is not indicated unless there is suspicion of trauma. Analgesics may help with pain, but they don't address the underlying issue of voiding difficulty. **. 36. A 28-week pregnant woman with a history of gestational diabetes asks the nurse when she should begin monitoring her blood glucose levels. What is the nurse's best response? A. You should begin monitoring your blood glucose levels immediately and continue until after delivery. B. You will begin monitoring your blood glucose levels at 36 weeks gestation. C. You do not need to monitor your blood glucose levels after 24 weeks. D. You should monitor your blood glucose levels only if you experience symptoms of hypoglycemia. Answer. A. You should begin monitoring your blood glucose levels immediately and continue until after delivery. Rationale. Women with gestational diabetes need to monitor their blood glucose levels throughout pregnancy and postpartum to manage the condition. It's essential to monitor glucose levels earlier than 36 weeks to prevent complications. Symptoms of hypoglycemia are unreliable indicators of glucose control, and gestational diabetes requires more proactive management. **. 37. A 38-week pregnant woman presents with regular contractions and cervical dilation. Which stage of labor is she in? A. First stage. B. Second stage. C. Third stage. D. Fourth stage. Answer: A. First stage. Rationale: the first stage of labor begins with regular contractions and cervical dilation, lasting until full dilation, 10 centimeters. The second stage starts once the cervix is fully dilated and involves the pushing phase. The third stage involves the delivery of the placenta, and the fourth stage is the immediate postpartum period. **. 38. Which of the following is the primary purpose of magnesium sulfate in the management of preeclampsia? A. To lower blood pressure. B. To prevent seizures. C. To promote uterine relaxation. D. To improve liver function. Answer: B. To prevent seizures. Rationale: magnesium sulfate is used to prevent seizures in women with preeclampsia or eclampsia, which are severe complications of high blood pressure. It does not directly lower blood pressure, but is effective in preventing convulsions. Magnesium sulfate also does not promote uterine relaxation or improve liver function. **. 39. A nurse is assessing a postpartum woman who is breastfeeding. Which of the following would be an appropriate nursing action to address sore nipples? A. Recommend the use of a nipple shield. B. Advise the patient to avoid breastfeeding for a few days. C. Encourage the patient to express milk between feedings. D. Suggest the use of lanolin cream or warm compresses. Answer: D. Suggest the use of lanolin cream or warm compresses. Rationale: lanolin cream can help soothe sore nipples, and warm compresses can reduce discomfort. Nipple shields can sometimes be helpful, but should not be the first intervention. Avoiding breastfeeding is not recommended, as this can interfere with milk production. Expressing milk may help but is not the first-line recommendation for sore nipples. **. 40. Which of the following is the most important intervention for a postpartum woman who is showing signs of deep vein thrombosis, DVT? A. Administer anticoagulant therapy as prescribed. B. Apply heat to the affected leg to reduce swelling. C. Encourage ambulation to promote circulation. D. Elevate the leg and apply compression stockings. Answer: A. Administer anticoagulant therapy as prescribed. Rationale: the primary treatment for DVT involves anticoagulant therapy to prevent clot extension and embolism. Applying heat, encouraging ambulation, and using compression stockings are supportive measures but are not the first-line interventions for DVT. Anticoagulant therapy is essential in preventing complications from DVT. **. 41. A 35-week pregnant woman is diagnosed with placenta previa. What is the primary concern with this condition? A. Premature birth. B. Excessive bleeding during labor and delivery. C. Fetal distress during contractions. D. Prolonged labor. Answer: B. Excessive bleeding during labor and delivery. Rationale: the primary concern with placenta previa is excessive bleeding, especially during labor, as the placenta covers or is near the cervical opening. Premature birth can occur, but the major risk is bleeding. Fetal distress may occur, but is less common than bleeding. Prolonged labor can occur, but is not the most immediate concern. **. 42. Which of the following is the most important factor to consider when deciding whether a woman with a breech presentation should attempt a vaginal delivery? A. Fetal weight. B. Maternal pelvis size. C. Presence of labor contractions. D. Fetal flexibility and ability to rotate. Answer: B. Maternal pelvis size. Rationale: maternal pelvis size is the most important factor in determining whether a vaginal breech delivery is safe. If the pelvis is adequate, a vaginal delivery may be possible. Fetal weight, contractions, and flexibility are secondary considerations, but are not as critical in this decision-making process. **. 43. A nurse is teaching a pregnant woman about the importance of folic acid. Which of the following should the nurse emphasize about folic acid during pregnancy? A. It helps prevent neural tube defects. B. It helps promote fetal growth and development. C. It prevents preterm labor. D. It improves iron absorption in the body. Answer. A. It helps prevent neural tube defects. Rationale. Folic acid is crucial during pregnancy to prevent neural tube defects such as spina bifida and anencephaly. While it supports fetal growth, preterm labor, and iron absorption, its primary role is preventing neural tube defects. ***. 44. A nurse is caring for a 10-hour postpartum woman. Which of the following is the most important to assess to ensure adequate uterine contraction? A. Abdominal tenderness. B. Fundal height and consistency. C. Urinary retention. D. Vaginal bleeding amount and color. Answer. B. Fundal height and consistency. Rationale. Assessing the fundus for height and consistency is critical in evaluating uterine contraction and involution. A firm, contracted fundus is expected. Abdominal tenderness, urinary retention, and vaginal bleeding are important, but secondary to assessing uterine contraction in the postpartum period. ***. 45. A 30-year-old woman at 34 weeks gestation presents with shortness of breath, edema, and hypertension. What is the most likely diagnosis? A. Gestational hypertension. B. Pulmonary embolism. C. Preterm labor. D. Preeclampsia. Answer. D. Preeclampsia. Rationale. Preeclampsia can present with hypertension, edema, and shortness of breath. Pulmonary embolism would cause acute respiratory distress, and preterm labor does not typically present with these symptoms. Gestational hypertension does not typically present with edema and shortness of breath to the same extent. ***. 46. A 28-year-old woman in early pregnancy reports a positive pregnancy test. Which of the following is the best initial action for the nurse? A. Provide education about prenatal vitamins. B. Refer the patient for an ultrasound to confirm the pregnancy. C. Perform a complete physical exam. D. Begin assessing the patient's history for risk factors. Answer. A. Provide education about prenatal vitamins. Rationale. The initial action should be to provide education about prenatal care, including taking prenatal vitamins with folic acid. While an ultrasound is recommended later to confirm fetal viability and growth, early education on health promotion is a priority. Assessing history and performing a physical exam come later in the visit. ***. 47. A 36-week pregnant woman presents with sudden, severe abdominal pain and vaginal bleeding. Her uterus is tender to palpation. What is the most likely diagnosis? A. Placental abruption. B. Placenta previa. C. Ectopic pregnancy. D. Uterine rupture. Answer. A. Placental abruption. Rationale. Placental abruption presents with sudden, severe abdominal pain, vaginal bleeding, and uterine tenderness. Placenta previa presents with painless bleeding and soft uterus. Ectopic pregnancy would be a concern earlier in pregnancy, and uterine rupture typically presents with more intense pain and fetal heart rate abnormalities. ***. 48. A 25-week pregnant woman presents with severe headache, visual disturbances, and swelling of the hands and feet. What is the most likely cause of these symptoms? A. Preeclampsia. B. Gestational diabetes. C. Hyperemesis gravidarum. D. Migraine headache. Answer. A. Preeclampsia. Rationale. These symptoms are classic for preeclampsia, a pregnancy complication marked by high blood pressure and signs of end organ damage. Gestational diabetes does not cause visual disturbances or swelling in this manner. Hyperemesis gravidarum involves severe vomiting, not these symptoms, and migraines are typically unilateral headaches. ***. 49. A 28-week pregnant woman with a history of asthma presents with increased wheezing and shortness of breath. What is the most appropriate action? A. Administer albuterol as prescribed. B. Perform a vaginal examination to rule out preterm labor. C. Encourage the patient to take deep breaths and relax. D. Check fetal heart tones immediately. Answer. A. Administer albuterol as prescribed. Rationale. In a pregnant woman with asthma, albuterol is the first-line treatment to relieve bronchospasm and improve breathing. Vaginal exams and checking fetal heart tones are important, but not the first action in managing asthma symptoms. Relaxation techniques are helpful, but do not address the immediate respiratory issue. ***. 50. A 32-week pregnant woman reports severe headache, swelling in her hands, and vision changes. What is the most likely diagnosis? A. Preeclampsia. B. Hyperemesis gravidarum. C. Acute sinusitis. D. Tension headache. Answer: A. Preeclampsia. Rationale: the combination of headache, swelling, edema, and visual changes are classic signs of preeclampsia, which requires immediate evaluation. Hyperemesis gravidarum causes nausea and vomiting, not the symptoms described here. Acute sinusitis presents with facial pain, not edema or vision changes. Tension headaches are typically associated with stress and not visual disturbances. ***. 51. A postpartum woman is experiencing difficulty breastfeeding due to nipple pain. Which of the following is the best intervention? A. Reassure the patient that this will improve with time. B. Check the baby's latch to ensure proper positioning. C. Encourage the patient to stop breastfeeding for a few days to allow healing. D. Advise the patient to use a nipple shield to protect the nipples. Answer: B. Check the baby's latch to ensure proper positioning. Rationale: nipple pain often results from improper latch, which can be corrected by ensuring the baby is positioned correctly during breastfeeding. Simply reassuring the patient may delay addressing the cause of pain. Stopping breastfeeding is not recommended, as it could affect milk supply. Nipple shields are sometimes used, but checking latch is the first step. ***. 52. A woman at 20 weeks gestation presents with an ultrasound showing a low-lying placenta. What is the most appropriate action? A. Recommend a cesarean delivery. B. Reassure the patient and schedule a follow-up ultrasound in 4 to 6 weeks. C. Advise bed rest for the remainder of the pregnancy. D. Begin planning for early induction of labor. Answer: B. Reassure the patient and schedule a follow-up ultrasound in 4 to 6 weeks. Rationale: a low-lying placenta in early pregnancy may resolve as the uterus grows. Follow-up ultrasound in 4 to 6 weeks is recommended to assess if the placenta has moved. Cesarean delivery is not indicated until later in pregnancy, and bed rest or early induction are not necessary at this point. ***. 53. A 36-week pregnant woman reports severe abdominal pain and is found to have a rigid, board-like abdomen. What is the most likely diagnosis? A. Placental abruption. B. Placenta previa. C. Uterine rupture. D. Acute appendicitis. Answer: C. Uterine rupture. Rationale: uterine rupture is a medical emergency characterized by severe abdominal pain and a rigid abdomen. Placental abruption can present with pain and bleeding, but not typically with a board-like abdomen. Placenta previa usually presents with painless bleeding. Acute appendicitis would present with right lower quadrant pain, not diffuse abdominal rigidity. ***. 54. A nurse is teaching a pregnant woman about signs of preterm labor. Which of the following should be included in the teaching? A. Light spotting and cramping are normal during pregnancy. B. A change in vaginal discharge and pelvic pressure may indicate preterm labor. C. Severe back pain and fever are common signs of preterm labor. D. Preterm labor is uncommon and only occurs in high-risk pregnancies. Answer: B. A change in vaginal discharge and pelvic pressure may indicate preterm labor. Rationale: preterm labor may be signaled by a change in vaginal discharge, e.g., increased or mucus-like, and pelvic pressure. Light spotting and cramping can occur in normal pregnancy, but should be monitored. Severe back pain and fever indicate possible infection, but are not primary signs of preterm labor. Preterm labor can occur in any pregnancy, not just high-risk ones. ***. 55. A woman at 24 weeks gestation reports feeling fetal movement irregularly. What is the nurse's best response? A. You should contact your doctor immediately to schedule an ultrasound. B. Fetal movement should be regular by 24 weeks, so this is a sign of concern. C. Fetal movement can be irregular, especially in the second trimester. D. Fetal movement should be felt at least once every hour. Answer. C. Fetal movement can be irregular, especially in the second trimester. Rationale. It is normal for fetal movement to be irregular in the second trimester. By 28 weeks, fetal movement tends to become more regular. Immediate concern is not necessary unless there are additional symptoms like decreased movement or fetal distress. The recommendation to contact a doctor should be based on clinical signs, not just irregular movement. ***. 56. A nurse is caring for a postpartum woman who is experiencing excessive bleeding. What is the most important initial intervention? A. Administer oxytocin as prescribed. B. Perform a uterine massage to stimulate contraction. C. Insert an indwelling catheter to monitor urine output. D. Place the patient in a left lateral position to improve circulation. Answer. B. Perform a uterine massage to stimulate contraction. Rationale. The first step in managing postpartum hemorrhage is to perform a uterine massage to stimulate uterine contractions and control bleeding. Oxytocin may be administered afterward, but the initial intervention is massage. Monitoring urine output and positioning can be helpful, but they are not as urgent as stimulating uterine contractions. ***. 57. A nurse is caring for a pregnant woman with hyperemesis gravidarum. Which of the following interventions is most likely to be included in the treatment plan? A. Administering antiemetics, such as ondansetron. B. Providing a high-protein diet to reduce nausea. C. Encouraging the patient to stay in a prone position to reduce symptoms. D. Restricting fluid intake to avoid vomiting. Answer. A. Administering antiemetics, such as ondansetron. Rationale. Anti-nausea medications, such as ondansetron, are commonly used to treat hyperemesis gravidarum. A high-protein diet may not be tolerated due to nausea. Encouraging a prone position is not helpful for nausea. Restricting fluids can worsen dehydration, which is a concern in hyperemesis gravidarum. ***. 58. A nurse is teaching a pregnant woman about gestational diabetes. What is the most important dietary modification to include in the teaching? A. Eat frequent, small meals to maintain blood sugar levels. B. Avoid all sources of carbohydrates. C. Drink large amounts of water to flush out excess glucose. D. Consume a high-fat diet to prevent blood sugar spikes. Answer. A. Eat frequent, small meals to maintain blood sugar levels. Rationale. Eating frequent, small meals helps regulate blood sugar levels, which is essential in managing gestational diabetes. Avoiding all carbohydrates is not necessary and can lead to nutritional deficiencies. Drinking excessive water and consuming a high-fat diet are not recommended for managing blood sugar. ***. 59. A nurse is caring for a postpartum woman who has developed a fever and uterine tenderness. Which condition is most likely responsible? A. Endometritis. B. Mastitis. C. Urinary tract infection, UTI. D. Postpartum depression. Answer. A. Endometritis. Rationale. Endometritis is an infection of the uterine lining that often presents with fever and uterine tenderness postpartum. Mastitis involves breast pain and fever. A UTI presents with symptoms like dysuria, but not uterine tenderness. Postpartum depression affects mood, not physical symptoms like fever or uterine tenderness. ***. 60. A nurse is caring for a 20-week pregnant woman who is experiencing vaginal bleeding but no pain. What is the most likely cause? A. Placenta previa. B. Placental abruption. C. Ectopic pregnancy. D. Spontaneous abortion. Answer. A. Placenta previa. Rationale. Placenta previa can cause painless vaginal bleeding in the second trimester. Placental abruption typically presents with pain and bleeding. Ectopic pregnancy usually occurs earlier in pregnancy and presents with pain and abnormal bleeding. A spontaneous abortion is more common in the first trimester and typically involves pain and cramping. ***. 61. A 36-week pregnant woman reports sudden weight gain and swelling of the hands and feet. Which of the following should the nurse assess for? A. Preeclampsia. B. Gestational hypertension. C. Deep vein thrombosis. D. Normal pregnancy changes. Answer: A. Preeclampsia. Rationale: sudden weight gain and swelling can be signs of preeclampsia, especially when accompanied by hypertension. Gestational hypertension involves elevated blood pressure, but preeclampsia presents with additional symptoms, such as proteinuria. Deep vein thrombosis usually presents with localized pain and swelling in one leg, not generalized swelling. Swelling in pregnancy is common, but this pattern is concerning for preeclampsia. ***. 62. A nurse is educating a pregnant woman about preventing varicose veins. Which of the following should the nurse include? A. Avoid standing or sitting for long periods. B. Wear high-heeled shoes to improve circulation. C. Take long walks after each meal. D. Perform leg exercises only when experiencing swelling. Answer: A. Avoid standing or sitting for long periods. Rationale: avoiding prolonged standing or sitting can help prevent the formation of varicose veins by promoting circulation. High-heeled shoes should be avoided as they can contribute to poor circulation. Walking after meals is helpful for overall circulation, but is not the primary prevention for varicose veins. Leg exercises should be performed regularly, not only during swelling. ***. 63. A 40-week pregnant woman is in active labor with a fetal heart rate of 190 bpm. What should the nurse do next? A. Increase the intravenous fluids. B. Position the patient on her left side. C. Notify the healthcare provider immediately. D. Administer oxygen via face mask. Answer: C. Notify the healthcare provider immediately. Rationale: a fetal heart rate of 190 bpm is considered tachycardia and may indicate fetal distress. Immediate notification of the healthcare provider is necessary to assess the situation further. While increasing fluids, positioning the patient, and administering oxygen may be part of the overall management, the most urgent action is to notify the provider. ***. 64. A postpartum woman reports feeling very sad and disconnected from her baby. Which of the following is the most appropriate nursing response? A. This feeling is normal and should resolve in a few days. B. You may be experiencing postpartum depression and should talk to your doctor. C. Try to get more sleep and you will feel better soon. D. Most mothers feel disconnected at first, but this will pass. Answer: B. You may be experiencing postpartum depression and should talk to your doctor. Rationale: feelings of sadness and disconnection can be symptoms of postpartum depression, which requires further evaluation and treatment. Simply reassuring the patient without addressing the possibility of depression may delay appropriate care. Getting more sleep is helpful, but may not resolve the underlying depression. Postpartum sadness is normal to some extent, but when it affects functioning, it may indicate depression. ***. 65. A nurse is caring for a woman with a history of gestational hypertension. Which of the following should be included in her postpartum care plan? A. Close monitoring of blood pressure for at least 48 hours. B. Immediate administration of antihypertensive medications. C. Avoidance of breastfeeding to manage blood pressure. D. Encouragement to engage in vigorous exercise to prevent future hypertension. Answer: A. Close monitoring of blood pressure for at least 48 hours. Rationale: women with a history of gestational hypertension need close postpartum monitoring of blood pressure, as they are at risk for developing hypertension or preeclampsia. Antihypertensive medications are not necessary unless blood pressure is elevated. Breastfeeding can be safely done, and exercise should be moderate, not vigorous. ***. 66. A pregnant woman at 30 weeks gestation presents with swelling, headaches, and high blood pressure. Which condition should the nurse assess for immediately? A. Preeclampsia. B. Ectopic pregnancy. C. Gestational diabetes. D. Hyperemesis gravidarum. Answer: A. Preeclampsia. Rationale: swelling, headaches, and high blood pressure are hallmark signs of preeclampsia. This condition needs immediate evaluation to prevent further complications like eclampsia or fetal distress. Ectopic pregnancy occurs earlier in pregnancy and does not present with these signs. Gestational diabetes and hyperemesis gravidarum typically present with different symptoms. ***. 67. A nurse is caring for a postpartum woman who has just received a dose of morphine for pain. Which of the following should the nurse monitor for first? A. Blood pressure and heart rate. B. Respiratory rate and oxygen saturation. C. Level of consciousness and pupil response. D. Urine output and skin turgor. Answer: B. Respiratory rate and oxygen saturation. Rationale: after administering morphine, the most important aspects to monitor are respiratory rate and oxygen saturation due to the risk of respiratory depression. Blood pressure and heart rate should be monitored as well, but they are less immediately affected by morphine than respiration. Level of consciousness and pupil response may also be affected, but respiratory monitoring is prioritized. Urine output and skin turgor are not directly impacted by morphine. ***. 68. A nurse is caring for a postpartum woman with a history of gestational diabetes. Which of the following is most important to assess in the immediate postpartum period? A. Blood glucose levels. B. Blood pressure. C. Urine output. D. Fundal height. Answer: A. Blood glucose levels. Rationale: postpartum women with a history of gestational diabetes are at risk for both high and low blood glucose levels. Monitoring blood glucose is critical to prevent complications such as hypoglycemia or hyperglycemia. While blood pressure, urine output, and fundal height are important to assess postpartum, blood glucose levels are the most directly related to the previous condition of gestational diabetes. ***. 69. A nurse is assessing a 6-hour postpartum woman and finds that her fundus is soft and displaced to the right. What should the nurse do first? A. Perform a uterine massage and encourage the patient to void. B. Administer a dose of oxytocin as ordered. C. Assess for signs of infection and notify the healthcare provider. D. Reposition the woman and check the fundus again in 30 minutes. Answer: A. Perform a uterine massage and encourage the patient to void. Rationale: a soft and displaced fundus suggests that the bladder may be full, preventing the uterus from contracting properly. The first step is to perform a uterine massage and encourage the woman to void to help the uterus contract. Administering oxytocin may be necessary later, but the priority is ensuring the bladder is empty. Signs of infection are not indicated at this point, and further assessment is needed after the initial interventions. ***. 70. A woman at 34 weeks gestation is diagnosed with gestational hypertension. What is the most appropriate intervention? A. Recommend immediate delivery. B. Monitor blood pressure regularly and provide education on managing hypertension. C. Begin antihypertensive medications immediately. D. Encourage increased physical activity and rest. Answer: B. Monitor blood pressure regularly and provide education on managing hypertension. Rationale: gestational hypertension requires close monitoring of blood pressure. Immediate delivery is not typically indicated unless there are signs of worsening or complications like preeclampsia. Antihypertensive medications may be used if necessary, but the initial step is regular monitoring and patient education. Increased physical activity is not appropriate in this situation. ***. 71. A postpartum woman is concerned about not producing enough breast milk. Which of the following should the nurse recommend first? A. Use a breast pump to stimulate milk production. B. Offer frequent breastfeeding and ensure proper latch. C. Provide supplemental formula to ensure adequate nutrition. D. Recommend a lactation consultant immediately. Answer: B. Offer frequent breastfeeding and ensure proper latch. Rationale: the first step in addressing concerns about milk production is ensuring that the baby is breastfeeding frequently and correctly. A proper latch stimulates milk production. While breast pumps and lactation consultants may be helpful later, frequent, effective breastfeeding is the most important action. Supplemental formula is not recommended unless absolutely necessary. ***. 72. A nurse is caring for a 10-hour postpartum woman who is experiencing heavy vaginal bleeding. Which of the following interventions should the nurse implement first? A. Massage the fundus and assess for clots. B. Administer an oxytocin bolus. C. Insert an indwelling urinary catheter to monitor output. D. Call the healthcare provider for further assessment. Answer: A. Massage the fundus and assess for clots. Rationale: the first intervention for heavy postpartum bleeding is to massage the fundus, as a soft or boggy uterus may be the cause. After this, the nurse can assess for clots and manage bleeding further. Oxytocin may be administered afterward if necessary, but uterine massage is the first priority. Calling the healthcare provider is important, but should follow the initial interventions. ***. 73. A 37-week pregnant woman presents with a sudden loss of fetal movement. What should the nurse's priority action be? A. Perform a non-stress test and assess fetal heart tones. B. Reassure the patient that loss of movement is normal at this stage. C. Schedule an emergency ultrasound for fetal viability. D. Monitor the patient for 30 minutes and ask her to eat something sweet. Answer: A. Perform a non-stress test and assess fetal heart tones. Rationale: the priority is to assess fetal well-being by performing a non-stress test and checking fetal heart tones. A sudden loss of fetal movement is concerning, and immediate assessment is necessary. Reassurance is premature before confirming fetal status. An ultrasound may be needed later, but the immediate assessment involves fetal heart tones and non-stress testing. Monitoring and eating something sweet may help stimulate movement, but are not the first steps. ***. 74. A nurse is providing teaching to a pregnant woman with a history of preterm labor. Which of the following should the nurse include in the teaching? A. Resting in a recliner chair will help prevent contractions. B. Drink plenty of fluids to stay hydrated and prevent uterine irritability. C. Performing strenuous exercise will help strengthen the uterus. D. Avoid all sexual activity to prevent preterm labor. Answer: B. Drink plenty of fluids to stay hydrated and prevent uterine irritability. Rationale: staying well hydrated can help reduce uterine irritability, which can contribute to preterm labor. Resting in a recliner chair is not recommended, as regular movement and positioning can help prevent complications. Strenuous exercise should be avoided, as it can trigger contractions. While sexual activity may be restricted in some cases, it is not universally prohibited for women with a history of preterm labor. ***. 75. A postpartum woman is experiencing heavy bleeding and a boggy uterus. What should the nurse do first? A. Call the healthcare provider immediately. B. Massage the fundus and encourage the patient to void. C. Administer oxytocin as prescribed. D. Document the amount of bleeding and continue monitoring. Answer: B. Massage the fundus and encourage the patient to void. Rationale: the first intervention in this situation is to massage the fundus and encourage the woman to void. A boggy uterus is often a result of uterine atony, which can be improved with massage and by emptying the bladder. If these interventions are not effective, oxytocin may be administered. Calling the provider and documenting are important, but they come after initial interventions. ***. 76. A 28-week pregnant woman reports dizziness, weakness, and blurred vision. Which of the following should the nurse do first? A. Monitor fetal heart tones. B. Assess the woman's blood pressure and position. C. Administer glucose for possible hypoglycemia. D. Encourage deep breathing and rest. Answer: B. Assess the woman's blood pressure and position. Rationale: the symptoms described, dizziness, weakness, and blurred vision, could indicate hypotension, especially from supine hypotension syndrome. The first step is to assess blood pressure and change the woman's position, e.g., to her left side, to relieve pressure on the vena cava. Monitoring fetal heart tones may be important, but is secondary to managing the mother's symptoms. Administering glucose is appropriate for hypoglycemia, but it doesn't seem to be the most likely cause here. ***. 77. A woman is in labor at 39 weeks gestation. Her cervix is dilated to 6 centimeters, and contractions are every 4 minutes. The nurse notes that the fetal heart rate is 180 bpm. What is the most appropriate action? A. Increase intravenous fluids. B. Notify the healthcare provider. C. Reposition the woman to her left side. D. Administer oxygen to the patient. Answer: B. Notify the healthcare provider. Rationale: a fetal heart rate of 180 bpm is considered tachycardic and may be indicative of fetal distress. Immediate notification of the healthcare provider is necessary for further evaluation and management. While increasing fluids, repositioning, or administering oxygen may be helpful interventions, notifying the provider is the priority. ***. 78. A nurse is caring for a postpartum woman who is breastfeeding and experiencing cracked nipples. Which intervention should the nurse recommend first? A. Apply warm compresses to the nipples. B. Ensure the baby is latching properly during breastfeeding. C. Use a nipple shield to protect the nipples. D. Recommend stopping breastfeeding until the nipples heal. Answer: B. Ensure the baby is latching properly during breastfeeding. Rationale: cracked nipples are often caused by improper latch. The first step is to ensure that the baby is latching properly during breastfeeding. Applying warm compresses can help alleviate discomfort, but addressing the root cause, improper latch, is the priority. Nipple shields can be used in some cases, but should not be the first intervention. Stopping breastfeeding is not recommended, as it can interfere with milk production. ***. 79. A nurse is teaching a pregnant woman about weight gain during pregnancy. Which of the following statements indicates the need for further teaching? A. I should gain 25 to 35 pounds during pregnancy. B. Weight gain should be consistent throughout my pregnancy. C. I should gain more weight during my second trimester than my first. D. It is normal to gain the most weight in the third trimester. Answer: B. Weight gain should be consistent throughout my pregnancy. Rationale: weight gain is not typically consistent throughout pregnancy. Most women gain weight steadily in the second and third trimesters, but may have slower weight gain in the first trimester. The recommended weight gain during pregnancy depends on the woman's pre-pregnancy BMI, but the statement about consistent weight gain is incorrect. Weight gain should vary by trimester. The other statements are accurate guidelines for weight gain during pregnancy. ***. 80. A postpartum woman with type 1 diabetes reports feeling lightheaded and weak. What is the most appropriate action? A. Administer a bolus of insulin. B. Assess blood glucose levels and provide carbohydrates if necessary. C. Offer water to hydrate the patient. D. Encourage the patient to take a nap and rest. Answer: B. Assess blood glucose levels and provide carbohydrates if necessary. Rationale: lightheadedness and weakness in a postpartum woman with type 1 diabetes are likely signs of hypoglycemia. The first step is to check her blood glucose level and administer carbohydrates, such as juice or glucose tablets, if needed. Administering insulin could further lower blood sugar, which is not appropriate in this situation. Offering water and rest might be helpful, but they do not address the primary concern of hypoglycemia. ***. 81. A nurse is caring for a woman at 32 weeks gestation who presents with complaints of sharp, localized abdominal pain and vaginal bleeding. What is the most likely diagnosis? A. Placenta previa. B. Placental abruption. C. Ectopic pregnancy. D. Spontaneous abortion. Answer: B. Placental abruption. Rationale: placental abruption typically presents with sudden, sharp abdominal pain and vaginal bleeding. Placenta previa usually causes painless bleeding, and ectopic pregnancy typically presents with pain before 32 weeks. A spontaneous abortion is more common earlier in pregnancy and often involves cramping. ***. 82. A woman in labor at 39 weeks gestation has been receiving oxytocin to augment contractions. The nurse notes that the fetal heart rate is decelerating and remains low after the contraction ends. What is the nurse's priority action? A. Administer oxygen to the mother. B. Increase the rate of oxytocin. C. Change the mother's position. D. Notify the healthcare provider. Answer: A. Administer oxygen to the mother. Rationale: fetal heart rate decelerations that occur during contractions and do not return to baseline after the contraction may indicate fetal hypoxia, necessitating oxygen administration to the mother. Increasing oxytocin could exacerbate the problem, and changing the mother's position may help, but oxygen is the first priority. Notifying the provider comes after addressing immediate needs. ***. 83. A 36-week pregnant woman with preeclampsia is receiving magnesium sulfate therapy. Which of the following findings is most concerning to the nurse? A. Deep tendon reflexes of 2+. B. Respiratory rate of 14 breaths per minute. C. Urine output of 35 milliliters per hour. D. Serum magnesium level of 8 milligrams per deciliter. Answer: D. Serum magnesium level of 8 milligrams per deciliter. Rationale: a magnesium sulfate level of 8 milligrams per deciliter is above the therapeutic range, 4 to 7 mg/dl, which could result in toxicity. Respiratory rate and urine output are important to monitor, but they are not as immediately concerning as the magnesium level. Deep tendon reflexes of 2+ are normal, and urine output of 35 milliliters per hour is acceptable. ***. 84. A postpartum woman reports pain and redness in her right breast, accompanied by a low-grade fever. What should the nurse suspect? A. Mastitis. B. Breast engorgement. C. Galactocele. D. Inverted nipple. Answer: A. Mastitis. Rationale: mastitis is an infection of the breast tissue, typically characterized by pain, redness, and fever. Breast engorgement can cause discomfort but not redness or fever. A galactocele is a milk cyst, not an infection. An inverted nipple would not cause pain, redness, or fever. ***. 85. A nurse is caring for a postpartum woman who is hemorrhaging due to uterine atony. What is the first intervention the nurse should implement? A. Administer a uterotonic drug, such as oxytocin. B. Perform a uterine massage. C. Start an intravenous infusion of fluids. D. Insert a Foley catheter to measure urine output. Answer: B. Perform a uterine massage. Rationale: the first step in managing uterine atony, soft uterus, is to massage the fundus to stimulate contractions. Administering oxytocin, starting in 4, and inserting a Foley catheter are important subsequent interventions, but fundal massage is the priority. ***. 86. A nurse is assessing a postpartum woman 6 hours after delivery. Which of the following findings would be considered abnormal? A. Uterus firm and at the level of the umbilicus. B. Lochia rubra with a moderate amount of flow. C. Perineal area with edema and ecchymosis. D. Temperature of 100.4 degrees Fahrenheit 38 degrees Celsius. Answer: D. Temperature of 100.4 degrees Fahrenheit 38 degrees Celsius. Rationale: a mild temperature elevation in the first 24 hours postpartum can be normal, but a temperature of 100.4 degrees Fahrenheit 38 degrees Celsius is elevated and may indicate an infection. The other findings, firm uterus, moderate lochia rubra, and perineal edema, are all normal in the early postpartum period. ***. 87. A nurse is caring for a woman who is 8 weeks pregnant and has a history of recurrent spontaneous abortions. Which of the following interventions is the priority? A. Administer progesterone supplementation. B. Recommend bed rest to prevent miscarriage. C. Perform a cervical circlage. D. Monitor fetal heart rate with ultrasound. Answer: A. Administer progesterone supplementation. Rationale: progesterone supplementation has been shown to reduce the risk of miscarriage in women with a history of recurrent pregnancy loss. Bed rest, circlage, and monitoring fetal heart rate are appropriate, but progesterone is the most evidence-based intervention for this condition. ***. 88. A woman in labor is requesting an epidural for pain relief. Which of the following assessments should be completed prior to the procedure? A. Obtain a baseline blood pressure and assess for signs of a fever. B. Check the fetal heart rate for baseline patterns. C. Assess the woman's blood type and Rh factor. D. Confirm that the woman has been NPO for 12 hours. Answer: B. Check the fetal heart rate for baseline patterns. Rationale: prior to an epidural, the nurse should ensure fetal well-being by checking baseline fetal heart rate patterns. A baseline blood pressure is important, but it is not as immediately critical as fetal heart monitoring. Blood type and Rh factor are not needed before an epidural. While the woman may be asked to be NPO, it is not a requirement for an epidural specifically. ***. 89. A postpartum woman is concerned about the possibility of a blood clot after cesarean delivery. Which of the following should the nurse assess for first? A. Warmth, redness, and swelling in the calf. B. Increased blood pressure and heart rate. C. Headache, blurred vision, and abdominal pain. D. Shortness of breath and chest pain. Answer: A. Warmth, redness, and swelling in the calf. Rationale: deep vein thrombosis, DVT, is a common concern postpartum, particularly after cesarean delivery. The nurse should first assess for signs of DVT, including warmth, redness, and swelling in the calf. Increased blood pressure and heart rate may indicate other complications, but they are not specifically related to DVT. Shortness of breath and chest pain are signs of a possible pulmonary embolism, which is a complication of DVT but not the initial assessment. ***. 90. A nurse is educating a pregnant woman about proper nutrition during pregnancy. Which of the following dietary choices is most appropriate for the prevention of neural tube defects? A. A diet high in folic acid. B. A diet high in iron. C. A diet high in vitamin C. D. A diet high in calcium. Answer: A. A diet high in folic acid. Rationale: folic acid is crucial for preventing neural tube defects in the fetus. While iron, vitamin C, and calcium are also important for pregnancy, folic acid is specifically indicated for neural tube defect prevention. Women should take 400 to 800 micrograms of folic acid daily before conception and during pregnancy. ***. 91. A nurse is assessing a pregnant woman at 20 weeks gestation. The nurse notes that the uterus is located 4 centimeters above the umbilicus. How should the nurse interpret this finding? A. The woman is likely carrying twins. B. The gestational age is consistent with uterine size. C. The woman may have polyhydramnios. D. The fetus may be smaller than expected for gestational age. Answer: B. The gestational age is consistent with uterine size. Rationale: at 20 weeks of gestation, the uterus is typically at or near the level of the umbilicus. A uterine measurement of 4 centimeters above the umbilicus is normal and consistent with this gestational age. Carrying twins or having polyhydramnios could cause larger than expected uterine size, but this is not indicated here. A smaller than expected fetus would lead to a smaller uterus. ***. 92. A nurse is caring for a pregnant woman who is 24 weeks gestation and has been diagnosed with gestational diabetes. What is the priority nursing intervention? A. Monitor the woman's blood glucose levels regularly. B. Encourage a low-fat, high-protein diet. C. Educate the woman about the need for insulin therapy. D. Monitor fetal heart rate patterns. Answer: A. Monitor the woman's blood glucose levels regularly. Rationale: the priority intervention for a pregnant woman with gestational diabetes is regular monitoring of blood glucose levels to ensure maternal and fetal health. Although a low-fat, high-protein diet and insulin therapy may be important, glucose monitoring is the first step. Monitoring fetal heart rate patterns is important but secondary to controlling blood glucose levels. ***. 93. A nurse is caring for a postpartum woman who is breastfeeding. Which of the following should the nurse educate the woman about to promote successful breastfeeding? A. Start breastfeeding immediately after birth and nurse frequently. B. Wait until the baby is 1 to 2 weeks old to initiate breastfeeding. C. Limit breastfeeding to every 4 to 6 hours to allow the breasts to rest. D. Use a pacifier to calm the baby between feedings. Answer: A. Start breastfeeding immediately after birth and nurse frequently. Rationale: early initiation of breastfeeding and frequent nursing help establish a good milk supply and ensure the baby receives colostrum, which is rich in nutrients. Waiting until the baby is older or limiting feedings can interfere with milk production. Using a pacifier is not recommended in the early days of breastfeeding, as it can interfere with the baby's ability to latch and suck effectively. ***. 94. A postpartum woman reports pain in her right leg, and the nurse notes that her right calf is warm, red, and swollen. What is the priority action? A. Administer pain medication and reassure the patient. B. Elevate the affected leg and apply ice. C. Encourage ambulation to reduce swelling. D. Notify the healthcare provider and prepare for further assessment. Answer. D. Notify the healthcare provider and prepare for further assessment. Rationale. The symptoms described, warmth, redness, swelling, are indicative of deep vein thrombosis, DVT. Immediate notification of the healthcare provider is necessary for further assessment and intervention. Elevating the leg and applying ice may provide comfort, but the priority is to prevent complications like a pulmonary embolism. Ambulation could dislodge a clot, making it unsafe, ***. 95. A nurse is caring for a 10-hour postpartum woman who is experiencing a decreased level of consciousness. What is the nurse's first action? A. Assess the woman's blood glucose levels. B. Check the woman's vital signs, including blood pressure. C. Perform a head-to-toe assessment to identify possible complications. D. Notify the healthcare provider immediately. Answer. A. Assess the woman's blood glucose levels. Rationale. A decreased level of consciousness in a postpartum woman can be indicative of hypoglycemia, particularly if she has diabetes. Checking blood glucose levels is the priority action. Blood pressure and other assessments are important, but secondary to identifying the cause of altered consciousness. Immediate notification of the provider is necessary but comes after assessing the patient, ***. 96. A nurse is assessing a woman who is 28 weeks pregnant. She complains of swelling in her feet and ankles that worsens as the day progresses. What is the most appropriate response? A. Instruct her to elevate her legs frequently and avoid standing for long periods. B. Recommend an increase in sodium intake to reduce water retention. C. Encourage more fluid intake to help the kidneys flush out excess fluid. D. Suggest that she lie flat on her back to relieve pressure on the feet. Answer. A. Instruct her to elevate her legs frequently and avoid standing for long periods. Rationale. Swelling of the feet and ankles in pregnancy is common and is typically due to increased blood volume and pressure from the growing uterus. Elevating the legs and avoiding prolonged standing can help reduce the swelling. Increasing sodium intake can exacerbate edema, and lying flat on the back can worsen venous return, potentially causing hypotension, ***. 97. A woman who is 36 weeks pregnant presents with complaints of severe headaches, visual disturbances, and epigastric pain. What is the nurse's priority action? A. Administer antihypertensive medications. B. Assess blood pressure and report findings. C. Offer a mild analgesic for headache relief. D. Prepare the patient for delivery. Answer. B. Assess blood pressure and report findings. Rationale. The symptoms of headache, visual disturbances, and epigastric pain could indicate preeclampsia, a serious pregnancy complication. The first priority is to assess blood pressure, as elevated blood pressure is a key diagnostic criterion. Administering antihypertensive medications or preparing for delivery can occur after confirmation of preeclampsia. Offering analgesics is not appropriate in the case of a potential hypertensive crisis, ***. 98. A postpartum woman is experiencing heavy vaginal bleeding, and the nurse notes that the uterus is soft and boggy. What is the most appropriate action? A. Perform a fundal massage. B. Administer oxytocin intravenously. C. Increase intravenous fluids to restore blood volume. D. Insert a Foley catheter to monitor urine output. Answer. A. Perform a fundal massage. Rationale. A soft and boggy uterus is indicative of uterine atony, which is the leading cause of postpartum hemorrhage. The priority intervention is to massage the fundus to stimulate uterine contractions. Administering oxytocin, increasing fluids, and inserting a Foley catheter are important, but uterine massage is the first step in managing uterine atony, ***. 99. A nurse is caring for a 2-day-old newborn who has jaundice. Which of the following is the best initial intervention? A. Assess the bilirubin level and notify the healthcare provider. B. Initiate phototherapy immediately. C. Increase the infant's fluid intake. D. Assess for signs of infection. Answer: A. Assess the bilirubin level and notify the healthcare provider. Rationale: jaundice in newborns is common but requires evaluation to determine if bilirubin levels are high enough to require treatment, e.g., phototherapy. The first step is to assess bilirubin levels and notify the healthcare provider. Increasing fluid intake may help but is secondary. Phototherapy is indicated for higher levels of bilirubin. Infection is less likely to be the cause of jaundice at this stage. ***. 100. A nurse is educating a pregnant woman about the signs of preterm labor. Which of the following should the nurse include in the teaching? A. If you experience any cramping, call your healthcare provider immediately. B. If you have increased vaginal discharge, it's always a sign of labor. C. If you feel pelvic pressure or back pain, try resting and monitor the symptoms. D. If you experience a sudden gush of fluid from your vagina, you should wait 24 hours before calling the healthcare provider. Answer: C. If you feel pelvic pressure or back pain, try resting and monitor the symptoms. Rationale: preterm labor often presents with pelvic pressure, back pain, or cramping. Resting and monitoring symptoms is important, but the woman should contact her healthcare provider if symptoms persist or worsen. Cramping is a sign of possible labor, not necessarily something to ignore, but it's not the only indicator. Vaginal discharge can increase, but it's not a definitive sign of labor. A sudden gush of fluid should be reported immediately. ***. 101. A woman at 30 weeks gestation is diagnosed with gestational diabetes. What is the primary goal of managing this condition? A. To control maternal blood glucose levels and prevent complications for the fetus. B. To ensure the fetus is delivered early to prevent fetal complications. C. To promote weight gain in the mother to meet fetal nutritional needs. D. To eliminate the need for insulin therapy during labor and delivery. Answer: A. To control maternal blood glucose levels and prevent complications for the fetus. Rationale: the primary goal of managing gestational diabetes is to maintain maternal blood glucose levels within a normal range to prevent complications for both the mother and fetus. This includes avoiding fetal macrosomia, preterm birth, and neonatal hypoglycemia. Early delivery is not the goal unless complications arise, and weight gain should be controlled rather than promoted. Insulin therapy may still be needed during labor. ***. 102. A nurse is preparing to assess a postpartum woman's breasts. Which of the following is a normal finding during this assessment? A. Bilateral breast engorgement that is firm, swollen, and painful. B. A small amount of clear, yellowish colostrum expressed from the nipples. C. Focal areas of redness and warmth with a firm, painful lump. D. Both breasts soft and non-tender, with no milk production. Answer: B. A small amount of clear, yellowish colostrum expressed from the nipples. Rationale: colostrum is the first form of breast milk and is typically clear to yellowish in color. This is a normal finding in the first few days postpartum. Engorgement, redness, warmth, and painful lumps may indicate mastitis or blocked ducts, which require intervention. Soft and non-tender breasts without milk production could suggest insufficient milk production. ***. 103. A postpartum woman is concerned about her ability to care for her newborn. She appears tearful and anxious. What is the most appropriate initial response by the nurse? A. Tell her not to worry, as this is normal and she will adjust soon. B. Refer her to a support group for new mothers. C. Acknowledge her concerns and provide reassurance that it's common to feel overwhelmed. D. Suggest she consider hiring a postpartum doula for assistance. Answer: C. Acknowledge her concerns and provide reassurance that it's common to feel overwhelmed. Rationale: it's normal for new mothers to feel overwhelmed, anxious, or tearful as they adjust to caring for a newborn. Acknowledging her feelings and providing reassurance is the first step in offering emotional support. While referring her to a support group or suggesting a doula may be helpful, the initial response should be empathetic and validating. Telling her not to worry minimizes her experience and is not supportive. ***. 104. A nurse is caring for a postpartum woman with a history of preeclampsia. Which of the following assessments is most important during the postpartum period? And assessing the woman's blood pressure frequently to detect hypertension. B. Monitoring the woman's lochia for signs of infection. C. Checking the woman's blood glucose levels regularly. D. Encouraging early ambulation to prevent thrombosis. Answer: A. Assessing the woman's blood pressure frequently to detect hypertension. Rationale: women with a history of preeclampsia are at increased risk for postpartum hypertension, including the development of eclampsia. Monitoring blood pressure frequently is crucial. Monitoring lochia, blood glucose, and encouraging ambulation are important, but do not address the primary concern of hypertension in this case. ***. 105. A nurse is preparing to administer a routine prenatal screening test for a woman at 16 weeks gestation. Which test should the nurse prepare for? A. Glucose tolerance test. B. Chorionic villus sampling, CVS. C. Maternal serum alpha-fetoprotein, SAFP. D. Amniocentesis. Answer: C. Maternal serum alpha-fetoprotein, SAFP. Rationale: maternal serum alpha-fetoprotein, SAFP, is typically screened at 16 weeks of gestation to assess for fetal neural tube defects and other abnormalities. The glucose tolerance test is done later in pregnancy, around 24 to 28 weeks. CVS and amniocentesis are invasive tests typically offered for higher-risk pregnancies. ***. 106. A nurse is caring for a 5-day-old newborn with a positive result for congenital hypothyroidism. What is the nurse's priority action? A. Administer thyroid hormone replacement therapy. B. Educate the parents about the condition and its treatment. C. Monitor the newborn for signs of respiratory distress. D. Perform further laboratory testing to confirm the diagnosis. Answer: A. Administer thyroid hormone replacement therapy. Rationale: congenital hypothyroidism requires immediate thyroid hormone replacement therapy to prevent developmental delays and other complications. Education, monitoring, and further testing are important, but secondary to starting the required treatment. Signs of respiratory distress are not directly associated with hypothyroidism. ***. 107. A nurse is caring for a pregnant woman at 8 weeks gestation. Which of the following is a common early sign of pregnancy? A. Weight loss and fatigue. B. Morning sickness, nausea, and vomiting. C. Increased energy levels. D. Elevated blood pressure. Answer: B. Morning sickness, nausea, and vomiting. Rationale: morning sickness, characterized by nausea and vomiting, is a common early sign of pregnancy. Weight loss and fatigue, while common, are not as typical or expected as nausea. Increased energy and elevated blood pressure are not common during the first trimester. ***. 108. A nurse is caring for a pregnant woman who has been diagnosed with placenta previa. Which of the following interventions should be avoided? A. Vaginal examination. B. Ultrasound to assess fetal position. C. Bed rest with the head of the bed elevated. D. Administering corticosteroids to enhance fetal lung maturity. Answer: A. Vaginal examination. Rationale: in cases of placenta previa, a vaginal examination should be avoided as it could cause hemorrhage. Ultrasound, bed rest, and corticosteroids are appropriate interventions. A vaginal exam could disrupt placental attachment and lead to complications. ***. 109. A nurse is caring for a pregnant woman at 20 weeks gestation. Which of the following findings requires immediate notification of the healthcare provider? A. Decreased fetal movement for 1 day. B. Mild pelvic pressure after physical activity. C. Swelling of the legs and feet that improves with rest. D. Occasional round ligament pain. Answer: A. Decreased fetal movement for 1 day. Rationale: a sudden decrease in fetal movement can indicate fetal distress and requires immediate notification of the healthcare provider for further evaluation. Mild pelvic pressure, swelling, and round ligament pain are common and typically do not require immediate intervention unless symptoms worsen or persist. ***. 110. A nurse is educating a postpartum woman about self-care measures. Which of the following instructions is most appropriate? A. You should avoid all physical activity for the first 6 weeks. B. It's normal to have heavy bleeding for several weeks postpartum. C. You can begin using tampons once you stop bleeding. D. You should report any symptoms of severe headache, blurred vision, or swelling in the legs. Answer. D. You should report any symptoms of severe headache, blurred vision, or swelling in the legs. Rationale. Severe headache, blurred vision, and swelling in the legs can be signs of postpartum preeclampsia or other complications and should be reported immediately. Light physical activity and gradual return to exercise are encouraged after 6 weeks. Bleeding typically decreases after the first few days, not lasting for several weeks. Tampons should not be used until after the first postpartum checkup. ***. 111. A nurse is caring for a 2-day-old newborn who is breastfed exclusively. The mother is concerned that her baby is not producing enough urine. What should the nurse suggest? A. Encourage the mother to increase the frequency of breastfeeding sessions. B. Recommend that the mother supplement with formula until the baby produces more urine. C. Suggest that the baby be evaluated for dehydration. D. Advise the mother to monitor urine output and report back in 48 hours. Answer. A. Encourage the mother to increase the frequency of breastfeeding sessions. Rationale. Frequent breastfeeding helps ensure that the newborn gets enough fluid and nutrition, which leads to more urine output. Newborns may initially urinate infrequently, but increasing breastfeeding can promote adequate hydration. Supplementing with formula is not necessary unless dehydration is suspected. Monitoring urine output and delaying action is not the best approach. ***. 112. A pregnant woman at 32 weeks gestation complains of sudden onset, severe abdominal pain. Which of the following findings would be most concerning? A. Bloody vaginal discharge. B. Absence of fetal movement. C. Low back pain radiating to the legs. D. Mild cramping with intermittent contractions. Answer. A. Bloody vaginal discharge. Rationale. Sudden onset abdominal pain with bloody vaginal discharge could indicate a placental abruption, a life-threatening condition. This requires immediate intervention. Absence of fetal movement, while concerning, may not be directly related to the pain. Low back pain and mild cramping are common in late pregnancy and less urgent in the context of abdominal pain. ***. 113. A nurse is teaching a pregnant woman about proper nutrition during pregnancy. Which of the following statements indicates understanding? A. I should avoid all dairy products because they may make me sick. B. I need to increase my intake of folic acid to help prevent birth defects. C. I should limit my intake of protein to avoid gaining too much weight. D. I should avoid foods high in iron, as they can cause constipation. Answer. B. I need to increase my intake of folic acid to help prevent birth defects. Rationale. Folic acid is essential during pregnancy to prevent neural tube defects in the fetus. Dairy products, protein, and iron are important for a healthy pregnancy, and they should not be limited unless medically necessary. Iron-rich foods should be encouraged despite the potential for constipation. ***. 114. A nurse is assessing a pregnant woman at 20 weeks gestation. Which of the following findings is most concerning? A. Mild ankle edema. B. Increased vaginal discharge. C. Severe headache and blurred vision. D. Stretch marks on the abdomen. Answer. C. Severe headache and blurred vision. Rationale. Severe headache and blurred vision may indicate preeclampsia, a potentially life-threatening condition that requires immediate medical attention. Mild ankle edema, increased vaginal discharge, and stretch marks are common and not typically concerning during pregnancy. ***. 115. A nurse is caring for a postpartum woman who is breastfeeding. Which of the following is most important to include in teaching about breastfeeding? A. Breastfeeding should occur every 3 to 4 hours to ensure proper milk production. B. You should introduce formula to the baby if breastfeeding is painful. C. Try to breastfeed on demand to encourage milk production. D. Breastfeeding should be avoided if you're experiencing sore nipples. Answer. C. Try to breastfeed on demand to encourage milk production. Rationale. Breastfeeding on demand helps to stimulate milk production and provides the baby with the necessary nutrients. Limiting breastfeeding to every 3 to 4 hours may reduce milk production. Introducing formula can interfere with breastfeeding success and should be avoided unless medically indicated. Sore nipples are common but can often be alleviated with proper latch techniques. ***. 116. A nurse is assessing a woman in labor. The fetal heart rate is 160 beats per minute, and the uterus is contracting every 2 to 3 minutes for 60 seconds. What is the most appropriate action? A. Notify the healthcare provider immediately for abnormal fetal heart rate. B. Reassess the fetal heart rate after the next contraction. C. Increase the fluids to improve fetal oxygenation. D. Assess the maternal vital signs for signs of infection. Answer. B. Reassess the fetal heart rate after the next contraction. Rationale. A fetal heart rate of 160 beats per minute can be normal in labor, and the contractions described are typical for the active phase of labor. The nurse should reassess the fetal heart rate to determine if the pattern remains stable. Immediate intervention is not required unless there is a significant change in fetal heart rate. Increased fluids and assessing maternal vital signs are important, but they are secondary to monitoring fetal status. ***. 117. A nurse is caring for a postpartum woman with a second-degree laceration. Which of the following interventions should be included in the plan of care? A. Apply a warm compress to the perineal area to promote healing. B. Instruct the woman to avoid sitting for the first 24 hours to reduce swelling. C. Encourage the woman to perform Kegel exercises to strengthen pelvic muscles. D. Provide stool softeners to prevent straining during bowel movements. Answer. D. Provide stool softeners to prevent straining during bowel movements. Rationale. Providing stool softeners is essential for women with perineal lacerations to prevent constipation and straining, which could cause further injury to the area. Warm compresses can help with comfort, but are not as critical for healing. Avoiding sitting and encouraging Kegel exercises are not recommended in the immediate postpartum period. ***. 118. A nurse is assessing a pregnant woman who is at 40 weeks gestation. Which of the following findings would be most concerning? A. Increased vaginal discharge. B. Decreased fetal movement. C. Mild swelling of the ankles. D. Positive fetal kick counts. Answer. B. Decreased fetal movement. Rationale. Decreased fetal movement can indicate fetal distress and requires immediate evaluation. Increased vaginal discharge and mild swelling of the ankles are common in late pregnancy and not typically concerning unless other symptoms are present. Positive fetal kick counts indicate a healthy, active fetus. ***. 119. A nurse is caring for a 2-day-old infant who has jaundice. Which of the following interventions is most appropriate? A. Assess the bilirubin level and monitor for worsening jaundice. B. Administer phototherapy immediately. C. Increase the infant's fluid intake to flush out excess bilirubin. D. Reassure the parents that jaundice is not uncommon and will resolve on its own. Answer. A. Assess the bilirubin level and monitor for worsening jaundice. Rationale. It is important to assess the bilirubin level to determine if treatment is necessary, as some jaundice in newborns resolves on its own. Phototherapy is only indicated for higher levels of bilirubin. Increasing fluid intake is beneficial for hydration, but does not treat the underlying cause of jaundice. Reassurance alone is insufficient without assessment. ***. 120. A nurse is assessing a pregnant woman at 36 weeks gestation. Which of the following findings should prompt further investigation for a potential complication? A. Mild ankle edema that improves with rest. B. Occasional cramping that resolves with hydration. C. Sudden onset severe headache with blurred vision. D. Positive fetal movements and a reactive non-stress test. Answer. C. Sudden onset severe headache with blurred vision. Rationale. Sudden onset severe headache and blurred vision can be symptoms of preeclampsia, a serious condition requiring immediate attention. Mild ankle edema and occasional cramping are common in late pregnancy and usually do not require intervention unless symptoms worsen. Positive fetal movements and a reactive non-stress test are reassuring signs of fetal well-being. Asterisk, asterisk. 121. A nurse is assessing a woman in labor. The fetal heart rate is 120 bpm and the uterine contractions are every 3 minutes, lasting 45 seconds. The nurse should A. Document the findings and continue to monitor. B. Notify the healthcare provider immediately for abnormal fetal heart rate. C. Reposition the patient to see if the fetal heart rate improves. D. Administer oxygen via mask to improve fetal oxygenation. Answer. A. Document the findings and continue to monitor. Rationale. A fetal heart rate of 120 bpm and contractions occurring every 3 minutes for 45 seconds are within normal limits during labor. Therefore, the nurse should document the findings and continue monitoring. No immediate interventions are needed unless the fetal heart rate or contraction pattern changes. Asterisk, asterisk. 122. A nurse is educating a pregnant woman about the importance of folic acid supplementation. Which of the following is a primary reason for the supplementation? A. To help prevent neural tube defects in the fetus. B. To promote adequate weight gain during pregnancy. C. To reduce the risk of gestational diabetes. D. To prevent the development of preeclampsia. Answer. A. To help prevent neural tube defects in the fetus. Rationale. Folic acid is essential for the development of the neural tube and helps prevent birth defects such as spina bifida and anencephaly. It is not directly related to weight gain, gestational diabetes, or preeclampsia prevention. Asterisk, asterisk. 123. A nurse is caring for a postpartum woman who is experiencing uterine atony. Which of the following is the priority intervention? A. Administer oxytocin as prescribed. B. To perform a fundal massage to stimulate uterine contractions. C. Administer a pain reliever as prescribed. D. Assist the woman to the bathroom to void. Answer. B. To perform a fundal massage to stimulate uterine contractions. Rationale. The first priority in managing uterine atony is to perform a fundal massage, as this helps stimulate uterine contractions and decrease bleeding. Oxytocin may be administered later if needed, but the priority is uterine massage. Pain relief and assisting with voiding are important but secondary to managing hemorrhage. Asterisk, asterisk. 124. A nurse is caring for a pregnant woman at 28 weeks gestation who has just received her glucose tolerance test results. Her blood glucose is 155 milligrams per deciliter. The nurse should A. Refer the patient for further testing to assess for gestational diabetes. B. Provide the patient with a prescription for insulin therapy. C. Reassure the patient that this is within the normal range. D. Encourage the patient to increase her physical activity immediately. Answer. A. Refer the patient for further testing to assess for gestational diabetes. Rationale. A blood glucose level of 155 milligrams per deciliter is above the threshold for normal in a glucose tolerance test, indicating that the patient may have gestational diabetes. Referral for further testing, such as a 3-hour glucose tolerance test, is necessary for a definitive diagnosis. Reassurance is premature until a diagnosis is confirmed. Asterisk, asterisk. 125. A nurse is educating a postpartum woman who is planning to breastfeed. Which of the following is a common concern during the early days of breastfeeding? A. Mastitis and clogged milk ducts. B. Excessive milk production leading to engorgement. C. Insufficient milk supply and difficulty with latch. D. Breast reduction surgery causing difficulty with breastfeeding. Answer. C. Insufficient milk supply and difficulty with latch. Rationale. One of the most common concerns during early breastfeeding is the worry about insufficient milk supply or difficulty with latch. These issues can be resolved with proper positioning, education, and support. Mastitis, clogged ducts, and engorgement are more common later in the breastfeeding process. Breast reduction surgery can affect milk supply, but is not typically a concern in every case. Asterisk, asterisk. 126. A nurse is teaching a pregnant woman about the signs of preterm labor. Which of the following should be included in the teaching? A. You should rest and drink plenty of fluids if you experience frequent contractions. B. You should try to avoid walking, as this can lead to preterm labor. C. If you experience a sudden loss of appetite, You should go to the hospital immediately. D. You should stop breastfeeding immediately if you experience any contractions. Answer: A. You should rest and drink plenty of fluids if you experience frequent contractions. Rationale: resting and staying hydrated are key interventions to manage mild preterm labor symptoms. Frequent contractions can be a sign of preterm labor, and fluids may help stop them. Avoiding walking is unnecessary, and there is no need to stop breastfeeding in the case of contractions. Loss of appetite is not a common sign of preterm labor. ***. 127. A nurse is preparing to administer an epidural to a woman in labor. Which of the following assessments is most important before the procedure? A. Assessing the woman's blood pressure. B. Assessing the woman's pain level. C. Assessing the woman's temperature. D. Assessing the fetal heart rate. Answer: A. Assessing the woman's blood pressure. Rationale: assessing blood pressure is crucial before administering an epidural because the procedure can cause hypotension, which can negatively affect both the mother and the fetus. Pain level, temperature, and fetal heart rate should also be monitored, but are not as immediate priorities in this context. ***. 128. A nurse is caring for a postpartum woman with a history of gestational hypertension. Which of the following assessments is most important during the postpartum period? A. Monitoring the woman's blood pressure for signs of preeclampsia. B. Monitoring the woman's blood glucose levels. C. Encouraging the woman to ambulate frequently to prevent deep vein thrombosis, DVT. D. Monitoring the woman's fundal height for signs of uterine atony. Answer: A. Monitoring the woman's blood pressure for signs of preeclampsia. Rationale: women with a history of gestational hypertension are at higher risk for developing preeclampsia during the postpartum period. Therefore, frequent blood pressure monitoring is crucial. Monitoring blood glucose levels, encouraging ambulation, and assessing for uterine atony are also important but not the top priority in this case. ***. 129. A nurse is educating a pregnant woman at 30 weeks gestation on how to perform kick counts. The nurse explains that A. The woman should count fetal movements once a day for 1 hour. B. The woman should count fetal movements twice a day for 2 hours. C. The woman should count fetal movements after meals for 30 minutes. D. The woman should report fewer than 10 movements in 2 hours to her healthcare provider. Answer: D. The woman should report fewer than 10 movements in 2 hours to her healthcare provider. Rationale: the recommended practice for fetal kick counts is for the woman to count fetal movements at least once a day for 2 hours or until she feels 10 movements. Fewer than 10 movements in 2 hours should prompt the woman to report to her healthcare provider for further evaluation. Kick counts should not be done only after meals or for only 30 minutes. ***. 130. A nurse is caring for a pregnant woman with a diagnosis of hyperemesis gravidarum. Which of the following interventions is most appropriate? A. Encourage the woman to eat small, frequent meals. B. Administer antiemetic medications as prescribed. C. Provide intravenous fluids for hydration. D. Advise the woman to avoid all foods and liquids until symptoms subside. Answer: C. Provide intravenous fluids for hydration. Rationale: hyperemesis gravidarum causes severe vomiting and dehydration. The priority intervention is to provide intravenous fluids to rehydrate the woman. Antiemetic medications may also be prescribed, and small, frequent meals can help once the woman's condition improves. Avoiding all foods and liquids is not recommended and may worsen dehydration. ***. 131. A nurse is educating a postpartum woman on the care of her perineal area after delivery. Which of the following should the nurse include in the teaching? A. You should avoid using ice packs on your perineum to prevent infection. B. You should perform sitz baths 2 to 3 times a day to promote healing. C. You should keep the perineal area dry at all times, even after using the bathroom. D. You should avoid any type of perineal care for the first 24 hours. Answer: B. You should perform sitz baths 2 to 3 times a day to promote healing. Rationale: sitz baths are an effective way to promote healing and reduce discomfort after vaginal delivery. Ice packs may be used during the first 24 hours, but not for long-term care. Keeping the perineal area dry is important, but moistening with a sitz bath is also helpful for healing. Avoiding perineal care is not recommended. Asterisk, asterisk. 132. A nurse is caring for a pregnant woman who is 36 weeks gestation. She complains of severe heartburn. Which of the following interventions should the nurse recommend? A. Try drinking warm milk to soothe the stomach. B. Use over-the-counter antacids such as sodium bicarbonate. C. Avoid eating large meals and lying down after eating. D. Increase your intake of spicy foods to help with digestion. Answer. C. Avoid eating large meals and lying down after eating. Rationale. To alleviate heartburn during pregnancy, it is important to avoid large meals and to refrain from lying down after eating. Warm milk may help in some cases, but is not the primary intervention. Sodium bicarbonate is not recommended due to its high sodium content. Spicy foods may exacerbate heartburn. Asterisk, asterisk. 133. A nurse is caring for a woman in labor who is experiencing early decelerations on the fetal heart rate monitor. Which of the following is the most appropriate action? A. Change the woman's position to improve fetal oxygenation. B. Increase the fore fluids to improve fetal heart rate. C. Document the findings as a normal variation and continue monitoring. D. Prepare the woman for an emergency cesarean section. Answer. C. Document the findings as a normal variation and continue monitoring. Rationale. Early decelerations are a normal finding in labor and are typically caused by fetal head compression during contractions. They usually do not require any intervention beyond documentation and continued monitoring. Changing the woman's position or increasing fore fluids is not necessary unless the fetal heart rate pattern changes. Emergency cesarean delivery is not indicated for early decelerations. Asterisk, asterisk. 134. A nurse is caring for a pregnant woman at 8 weeks gestation who is diagnosed with a urinary tract infection, UTI. Which of the following medications should the nurse anticipate being prescribed? A. Amoxicillin. B. Ciprofloxacin. C. Tetracycline. D. Sulfamethoxycyl trimethoprim. Answer. A. Amoxicillin. Rationale. Amoxicillin is considered safe for use during pregnancy to treat urinary tract infections. Ciprofloxacin and tetracycline are contraindicated during pregnancy due to their potential harm to the fetus. Sulfamethoxycyl trimethoprim is generally avoided in the first trimester due to the risk of teratogenic effects. Asterisk, asterisk. 135. A nurse is educating a postpartum woman about breastfeeding. Which of the following statements by the mother indicates a need for further teaching? A. I should breastfeed my baby at least 8 to 12 times a day. B. It is normal for my breasts to feel engorged after the first few days of breastfeeding. C. I should introduce solid foods at 2 months of age to supplement breastfeeding. D. I should offer both breasts at each feeding to ensure my baby gets enough milk. Answer. C. The infant's lips are turned outward, and the tongue is visible. Rationale. Incorrect latch may be indicated by the infant's lips being turned outward and the tongue visible, which can cause discomfort and ineffective feeding. A proper latch involves the infant's mouth being wide open and covering the entire areola. A tingling sensation is usually a sign of milk ejection, not poor latch. The infant's feeding time is normal if latch is correct. Asterisk, asterisk. 136. A nurse is assessing a postpartum woman who is breastfeeding. Which of the following signs indicates that the infant is not latching correctly? A. The mother feels a tingling sensation in her nipples. B. The infant's mouth is wide open and covers the entire areola. C. The infant's lips are turned outward, and the tongue is visible. D. The infant is feeding for 15 minutes per breast. Answer. C. The infant's lips are turned outward, and the tongue is visible. Rationale. Incorrect latch may be indicated by the infant's lips being turned outward and the tongue visible, which can cause discomfort and ineffective feeding. A proper latch involves the infant's mouth being wide open and covering the entire areola. A tingling sensation is usually a sign of milk ejection, not poor latch. The infant's feeding time is normal if latch is correct. Asterisk, asterisk. 137. A nurse is caring for a postpartum woman who is experiencing difficulty with breastfeeding. Which of the following should the nurse assess first? A. the infant's sucking pattern. B. The mother's nipple condition. C. The amount of milk the mother is producing. D. The infant's weight. Answer: B. The mother's nipple condition. Rationale: before assessing the infant's sucking pattern, milk production, or weight, the nurse should assess the mother's nipple condition. Nipple pain, cracks, or lesions can interfere with successful breastfeeding. Once the nipple condition is addressed, the nurse can assess the other factors to improve breastfeeding success. 138. A nurse is caring for a postpartum woman who has had a cesarean delivery. Which of the following interventions is most important in the immediate postpartum period? A. Encouraging early ambulation to prevent deep vein thrombosis, DVT. B. Assessing the incision site for signs of infection. C. Promoting adequate fluid intake to prevent constipation. D. Monitoring for signs of respiratory distress. Answer: A. Encouraging early ambulation to prevent deep vein thrombosis, DVT. Rationale: early ambulation is essential to prevent complications such as deep vein thrombosis, DVT, after a cesarean delivery. While assessing the incision site, promoting fluid intake, and monitoring for respiratory distress are important, preventing DVT through early movement is a priority for the postpartum woman. 139. A nurse is caring for a postpartum woman who had a vaginal delivery with a small perineal tear. Which of the following interventions is appropriate? A. Apply an ice pack to the perineal area to reduce swelling. B. Teach the woman to perform perineal self-care with warm water and soap. C. Encourage early ambulation to prevent blood clots. D. Apply a topical antibiotic ointment to the perineal tear. Answer: A. Apply an ice pack to the perineal area to reduce swelling. Rationale: apply an ice pack to the perineal area for the first 24 hours can help reduce swelling and provide pain relief. Perineal self-care with warm water is helpful after the initial 24 hours, but ice should be used first. Early ambulation is important for circulation, but is not specific to the care of a perineal tear. Topical antibiotics are typically not necessary unless there is a sign of infection. 140. A nurse is caring for a pregnant woman who has been diagnosed with gestational hypertension. Which of the following findings is most concerning? A. Mild ankle edema. B. A blood pressure reading of 140/90 mmHg. C. A blood pressure reading of 160/100 mmHg with proteinuria. D. Occasional headaches that resolve with rest. Answer: C. A blood pressure reading of 160/100 mmHg with proteinuria. Rationale: a blood pressure of 160/100 mmHg combined with proteinuria is indicative of worsening preeclampsia, a potentially life-threatening condition. Mild ankle edema and occasional headaches are common in pregnancy and are not immediately concerning unless accompanied by other symptoms. 141. A nurse is assessing a 1-day-old newborn for jaundice. Which of the following interventions is most appropriate for this newborn? A. Observe for signs of jaundice for the next 48 hours before initiating treatment. B. Notify the healthcare provider for a bilirubin level and consider phototherapy. C. Provide the baby with extra fluids to help flush out the bilirubin. D. Encourage the mother to breastfeed every 3 to 4 hours to help reduce jaundice. Answer: B. Notify the healthcare provider for a bilirubin level and consider phototherapy. Rationale: jaundice in a newborn should be assessed and monitored closely. If the bilirubin level is high, phototherapy may be needed to prevent complications. It is important to notify the healthcare provider for further evaluation. Although frequent breastfeeding can help prevent jaundice, phototherapy may still be necessary if bilirubin levels are elevated. 142. A nurse is caring for a 2-week-old infant with a history of low birth weight. The infant is exhibiting signs of respiratory distress. Which of the following is the first intervention? A. Administer oxygen via nasal cannula. B. Assess the infant's heart rate and respiratory rate. C. Call the healthcare provider for immediate assessment. D. Check the infant's blood glucose levels. Answer: B. Assess the infant's heart rate and respiratory rate. Rationale: The first step in managing respiratory distress is to assess the infant's heart rate and respiratory rate to determine the severity of distress. After assessment, oxygen may be administered if needed. Calling the healthcare provider and checking glucose levels may be appropriate later, but are secondary to assessing respiratory status. ***. 143. A nurse is assessing a pregnant woman at 12 weeks gestation. Which of the following findings would be most concerning? A. Mild nausea and vomiting. B. Faint fetal heart tones heard with a Doppler. C. Dark brown spotting with no cramping. D. Sudden cessation of nausea and vomiting after 12 weeks. Answer. D. Sudden cessation of nausea and vomiting after 12 weeks. Rationale. The sudden cessation of nausea and vomiting after the first trimester can be a warning sign of a miscarriage or other complications. While mild nausea and vomiting and faint fetal heart tones are common in early pregnancy, sudden cessation of symptoms requires further evaluation. Dark brown spotting may not be concerning, but it should still be monitored. ***. 144. A nurse is caring for a woman in labor who is experiencing late decelerations on the fetal heart rate monitor. Which of the following interventions is most appropriate? A. Place the woman in a left lateral position. B. Administer a bolus of intravenous fluids. C. Increase the infusion rate of the 4 fluids. D. Prepare the woman for an emergency cesarean section. Answer. A. Place the woman in a left lateral position. Rationale. Late decelerations are often associated with uteroplacental insufficiency, and repositioning the woman to the left lateral position can improve placental perfusion. Administering fluids and increasing the infusion rate may help with hydration but will not address the underlying cause. A cesarean section is not immediately necessary unless the decelerations persist. ***. 145. A nurse is caring for a postpartum woman who is experiencing a lochia rubra that has a foul odor. The nurse should A. Assess the perineal area for signs of infection. B. Encourage the woman to rest and hydrate to reduce odor. C. Document the finding and continue monitoring. D. Increase the frequency of perineal care with soap and water. Answer. A. Assess the perineal area for signs of infection. Rationale. A foul odor in lochia rubra may indicate an infection, and the nurse should assess the perineal area for signs of infection. Rest and hydration are helpful, but do not address potential infection. Documenting the finding and increasing perineal care are secondary to assessing and treating possible infections. ***. 146. A nurse is caring for a pregnant woman with preeclampsia. Which of the following is the priority nursing intervention? A. Monitor the woman's blood pressure every 15 minutes. B. Monitor fetal heart rate and movement. C. Administer magnesium sulfate as prescribed. D. Administer antihypertensive medications as prescribed. Answer. A. Monitor the woman's blood pressure every 15 minutes. Rationale. Monitoring blood pressure frequently is the priority in managing preeclampsia, as it can help detect worsening hypertension and prevent complications like eclampsia. Monitoring fetal heart rate, administering magnesium sulfate, and antihypertensives are also important, but controlling the blood pressure is the most urgent. ***. 147. A nurse is caring for a postpartum woman who is at risk for hemorrhage. Which of the following interventions should the nurse prioritize? A. Assessing the woman's fundus for tone and position. B. Encouraging the woman to begin breastfeeding. C. Monitoring the woman's urine output. D. Administering pain relief as prescribed. Answer. A. Assessing the woman's fundus for tone and position. Rationale. Assessing the fundus for tone and position is the most important intervention to prevent or identify postpartum hemorrhage. A soft or boggy fundus is a sign of uterine atony, which can lead to hemorrhage. While breastfeeding and monitoring urine output are important, the priority is addressing potential hemorrhage. Pain relief is secondary to hemorrhage prevention. ***. 148. A nurse is caring for a pregnant woman who has been diagnosed with gestational diabetes. Which of the following is the most appropriate action for managing blood glucose? A. Encourage the woman to limit carbohydrate intake to 30 grams per day. B. Monitor blood glucose levels regularly and adjust insulin as prescribed. C. Advise the woman to avoid all sweet foods and drinks completely. D. Recommend exercise after meals to help control blood sugar levels. Answer: B. Monitor blood glucose levels regularly and adjust insulin as prescribed. Rationale: the key to managing gestational diabetes is to monitor blood glucose levels regularly and adjust insulin as prescribed. Limiting carbohydrate intake to 30 grams per day is too restrictive. Sweet foods should be consumed in moderation, not avoided entirely. Exercise after meals can help control blood sugar, but it is not the primary method of management. ***. 149. A nurse is teaching a pregnant woman about the purpose of prenatal vitamin supplements. Which of the following vitamins is crucial for fetal neural tube development? A. Vitamin D. B. Vitamin C. C. Folic acid. D. Vitamin B12. Answer: C. Folic acid. Rationale: folic acid is essential for the development of the fetal neural tube and helps prevent neural tube defects such as spina bifida and anencephaly. Vitamin D is important for bone health, vitamin C for immune function, and vitamin B12 for red blood cell production, but they are not as crucial as folic acid for neural tube development. ***. 150. A nurse is caring for a woman in labor and is monitoring fetal heart rate, FHR, patterns. Late decelerations are noted. The nurse should first: A. Change the woman's position to the left lateral side. B. Administer oxygen via face mask. C. Increase the four fluids. D. Notify the healthcare provider. Answer: A. Change the woman's position to the left lateral side. Rationale: late decelerations typically indicate uteroplacental insufficiency. Changing a woman to a left lateral position can improve placental perfusion and relieve the decelerations. Oxygen administration and increasing four fluids can also help, but repositioning is the first action. Notifying the healthcare provider is necessary if interventions do not improve the FHR***.